to live their healthiest lives. And it's so important to continue the conversation on health equity to ensure people are granted opportunity and access to care. And despite their social, economic, and physical factors, here today to talk with us about this health equity and share an upcoming health equity symposium is Dr. Ajay Kumar, Chief Clinical Officer at Hartford HealthCare. Doctor, welcome.
Well, thank you so much. You mentioned very well, actually, health equity is such an important part here. And as most healthcare systems are still learning how do you actually better serve the community you live in and how you connect better, I think we've learned a lot about ourselves during the COVID times. We are really excited. Hartford HealthCare will be hosting a symposium from 8 o'clock to 2 o'clock on topic of health equity. And it's connecting the clinical work to the work which needs to be done in the communities. So we have panel speakers, which will include our own president, CEO, Jeff Lax, who will talk about his vision and how Hartford HealthCare really values the health equity as part of our value equation at this time. We'll talk about how it connects to the quality, with the work we do in day-to-day basis, how we align our services, what research we are doing in that term. But one of the most important conversation we would have in this part here is about how the payers and the healthcare system can come together to improve and address the disparity in healthcare to a certain extent. I'm hoping a lot of people will join this conversation as we go forward.
And doctor, tell us, how does equity relate to health disparities?
Well, for us to be able to provide our community with the appropriate healthcare, we have to understand the different levels of challenges the community faces, whether it's a socioeconomic climate, whether it's the racial issues, and access to healthcare. And as Hartford HealthCare continues to work and expand the access, especially for the patients who have difficult to find the right access, especially to the highest level of the clinical care, it's really important that we connect the dots in this conversation.
And tell us why it's so important to prioritize health equity.
Well, I think it's a fabric of what we do here in Hartford HealthCare. We have to be able to understand the disparities which exist in our communities, and to be able to design and provide the offerings from the clinical perspective to serve the need of the community. And we have so much to do in our society, and we have a mortality rate which differs between different racial component of the society. Access is very different. The food shortage is very different. So I think this is a work we hoping that others will join in, but the Hartford HealthCare will lead the effort in this conversation.
And doctor, tell us real quick, we have time for one more question. When is your conference?
It's tomorrow, starting at 8 o'clock in the morning. It's May 17th. It'll go until 2 o'clock. It's also a CME Summit, where that means the physicians and advanced practitioners gets credit for attending this for educational credits as well. So it's a wonderful conversation.
Hartford HealthCare Chief Clinical Officer Dr. Ajay Kumar, thank you so much for joining us. And we'll have more information on the conference on our website as well. Thank you.
Thank you very much.